Welcome to the Currents of Public Health webinar series, presented by the School of Public Health at Georgia State University. My name is Brian Greer, and I'm the Director of Development for the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is a conversation on vaping and smoking cessation. Our guest is Dr. David Ashley, who is a research professor at the School of Public Health at Georgia State. Dr. Ashley was appointed to this position in August 2017. Before that, he spent 33 years in the United States Public Health Service, retiring in 2016 at the rank of Assistant Surgeon General, Rear Admiral Lower Half. He was at the Environmental Health Laboratory of the Centers for Disease Control and Prevention's National Center for Environmental Health from 1983 until 2010. Then he started in June 2010. He was the inaugural director of the Office of Science of the Food and Drug Administration's Center for Tobacco Products. In this role, he was instrumental in carrying out the regulatory authorities of the 2019 law, which gave FDA authority to regulate tobacco products. Dr. Ashley has performed extensive research related to the impact of cigarette design and contents on the emissions from tobacco products, how people use tobacco products, and resulting biomarkers of exposure. He has published over 180 peer-reviewed articles and book chapters related to biophysics, environmental chemicals, biomarkers of exposure, and the constituents of tobacco and tobacco smoke. He has presented extensively at scientific meetings on the chemistry of tobacco and tobacco smoke and biomarkers of exposure. He serves on the World Health Organization Study Group for Tobacco Product Regulation and was the chair of the WHO Tobacco Laboratory Network from 2016 until 2010. He also currently serves on scientific advisory boards of 4 academic organizations carrying out tobacco product research. Welcome, Dr. Ashley, to the webinar, and I look forward to our conversation. And before we begin, I just want to say that if you have a question over the course of our conversation, please feel free to put it into the Q&A box, and we'll do our best to get those questions answered. So I want to start with our first question, if you would. Please tell us about your research and your history with tobacco research and regulation.
Well, thanks, Brian. I really appreciate the invitation to talk with you today. I think this will be very enjoyable. So my work with tobacco started in 1994. I was in the laboratory at CDC, and we got a visit from the folks in the Office of Smoking and Health of CDC. The director there was a guy named Michael Erickson, who was the director of the Office of Smoking and Health, and he came over and we discussed the issues around tobacco, and he asked for some laboratory support. And so we began doing work on tobacco, particularly looking at tobacco products themselves, their characteristics, and how that might influence their toxicity. And so I worked on that from 1994 through, as you said, 2010. And in 2010, I got the chance to go up to be the inaugural director at FDA in their new Center for Tobacco Products that was just being created as the director of the Office of Science. And when I got there, we had 15 staff. When I left, we had 325. So it was really creating an organization and putting together all of the aspects of regulation that were needed in that activity. So we did that. I did that for 7 years and retired and came back to Atlanta and started at Georgia State then. And so that's pretty much what my work has been over the years. Right now, I spend a lot of my time particularly working on new products and product modifications. One of the things that's concerned me about products particularly is when they are sent to the FDA for authorization, the FDA evaluates the products as they are designed by the company to be used. But once those products actually get into the hands of users, the first thing they do is they try to do different things with them. So they make modifications, they change them, they introduce new materials in, they make changes, and they no longer really represent the data that was provided by the company itself. And so most of my work right now is on looking at those modifications and trying to understand how users are modifying products like e-cigarettes and changing those instead of leaving them as the manufacturer created those.
Gotcha. So can you let us know a little bit more about the research in the School of Public Health Tobacco Control Group that they're carrying out on smoking and e-cigarettes?
So we've got a really diverse, we have a really great group in the School of Public Health, very different areas of emphasis. So Terry Pahacek, Yudong Wong, Lucy Popova, Scott Weaver, Claire Spears, and others work on a lot of different aspects of tobacco use. And so we look at the new products like ends and heated tobacco products and what those are and trying to understand those. We look at youth use, how kids are starting to use those products. We look at the economics around tobacco use. We do qualitative research. We do quantitative research. We have a good projects looking at communications. Lucy Popova leads a group looking at communications. We look at cessation and we look at disparities. And so we've got a really wide range of skills and interests in tobacco, trying to understand the problem as a whole, not just one narrow slice of the issue around tobacco and new products, but trying to understand the whole picture, which I believe gives us a much better view on these issues and helps us to understand them better.
So what have you found in your research concerning the effectiveness of e-cigarettes for smoking cessation?
So there have been a lot of studies done on this. This is a big issue, and there's a lot of discussion and differences of opinion on that. Our studies, which are primarily looking at real life use of e-cigarettes, the kind that's going on every day, has found that in most cases, smokers who take on e-cigarettes become dual users. Now, there's some that quit, but the vast majority of them become dual users. And a lot of that is because they smoke, but they're restricted in where they can smoke, but they find that by incorporating e-cigarettes into the process, they're actually able to use those e-cigarettes when they're not able to smoke, and they can smoke when they are able to smoke, and they become dual users. The vast majority of them do. And that's a big concern because the data has shown that those people that dual use with cigarettes and e-cigarettes get exposed to the same levels of harmful, potentially harmful constituents as actual smokers. And so unless people completely switch away from e-cigarettes and give up cigarettes completely and only smoke e-cigarettes, then they really don't get any kind of health benefit because they're continuing to get that exposure that leads to death and disease. And so it's a real issue. The whole issue around e-cigarettes still is a big concern.
So has the introduction of e-cigarettes onto the commercial retail market reduced smoking in any sort of way?
Well, we have, there's a difference of opinion on that. And what people have done, well, let me back up just a little bit. So smoking prevalence has been dropping for a long time. Since the 1960s, smoking prevalence, well, probably even before that, smoking prevalence has been dropping fairly steadily in the United States. And so there's a curve that you can look at is how many cigarettes are sold every year. And you can see that the levels are dropping and dropping and dropping. Some people, when they look around the year 2012, when e-cigarettes began to be introduced into the population, see a break in that curve. They see the slope changing somewhat, and they say that that's due to the introduction of e-cigarettes. So they're saying that smoking or e-cigarette introduction actually has an effect. I actually personally have a hard time seeing that. I've looked at those same curves, and I don't see a real big change in that slope over time. It looks to me that largely the continued decrease in cigarette use has been going on for many, many years and continues to go on. You don't see a real dramatic change. Again, maybe there's a small change, maybe there's a little bit of a blip, but you're really not seeing much of a change there in that slope of cigarette decrease has been going on for years and years.
So how do you explain the scientific discrepancies between studies that identified the effectiveness and those that have not? As far as
so there have been some really good clinical research studies that have been done around cessation. One of the best ones is by Peter Hajek from England, who did a really, really terrific clinical research study around that. It showed that what he showed was that e-cigarettes are more effective in helping people to quit compared to use of nicotine replacement therapy. It's a really very well designed study. The problem with that study is that, or the not the problem, it's more the caveats around that study is that the people that entered the study were, number one, given those e-cigarettes for free. So they were given months worth of free product. The product they were using was a really, really good product. It delivers nicotine very well. They were given behavioral counseling. So they were encouraged. The NRT people were too, but both sets were given behavioral counseling. And these people were also coached into how to properly use an e-cigarette to get the nicotine they needed from it. And so what they found was it was much more effective. In our own studies, which are real world kind of studies, what we found is something different, that those people generally don't completely switch to e-cigarettes and they're not very effective. And I honestly believe that if we could market e-cigarettes, if e-cigarettes became available to smokers under the conditions like are occurring in clinical research studies, you'd see a huge impact of e-cigarettes on smoking cessation. They'd be very beneficial, but that's not the real world. The real world is people drive over to the gas station, they buy an e-cigarette, they go in a grocery store, buy an e-cigarette. No one coaches them how to do it. They have to pay for it, and they're fairly expensive. They have to continue to go back and buy them again. They don't get behavioral counseling along with that. So what we're seeing in the clinical research studies are not really a mimic of what goes on in the real world. If we could somehow mimic those clinical research studies in the real world, I think those products would be much more effective in helping people smoke. So I think that's where we've got the dichotomy. That's the problem we've run into. We've got real world studies on how people are actually using those products, and we've got clinical research studies, which are different conditions. Somehow we need to marry those two things together so that we can use the best information we're gathering from those clinical research studies and apply that to the real world.
So what could be done to increase the likelihood of smoking cessation for those who are using e-cigarettes to quit smoking?
So the data is pretty clear that daily, regular use of e-cigarettes can be helpful in keeping people, helpful in people stopping to smoke. If you look at, and there have been several studies of this, not just our data, but other studies which have shown that daily use of e-cigarettes, where they're using them all the time in place of smoking, really does help people smoke. But in the real world, people use them intermittently. They use them just every once in a while. Somehow we've got to encourage people to be using those daily, regularly. I don't know if I don't really know the proper mechanism to make that happen. Providing those through some mechanism free of charge for smokers, making sure that smokers are the people that get them, providing them support so that they will know better how to use these products, providing them feedback, regular feedback on how it's going and whether they're being successful or not. All that kind of feedback and interaction would probably help make these products much more effective than they are right now out there in the real world.
So shifting gears a little bit, how has the pandemic impacted the use of vaping on smoking or smoking cessation?
So we actually did a study, and Luke is the primary author on the study, but we did a study looking at that, looking at what happened during the pandemic. And our study found what a lot of different studies found is that some people stopped smoking or decreased the amount of smoking. Some people increased the amount of smoking, and a lot of people just kept smoking the same. People would decrease smoking if they were primarily social smokers. If they smoked when they were around other people, and suddenly in the pandemic, they couldn't be around other people, and so they were smoking less. Other people were really stressed out, and the pandemic really caused them a lot of stress, and those cigarettes were the thing they turned to when they were in stress. And so those people would actually smoke more. So there were a lot of different factors around the pandemic. Going in, we thought one thing or the other, either that most people would smoke less or most people would smoke more. What we found is it is in most kind of scientific, some yes and some no, and a lot of people in the middle. And so there weren't any real big changes with the pandemic. The one thing for sure is, and a lot of people have tried to connect to this, is the pandemic and everything around it may have served as a source to help encourage some people. And so I know there were some people that were really trying to reach out and use this as an opportunity. But again, some people smoke less, some people smoke more. A lot of people pretty much smoke the same as they did before.
Well, I'm also curious about, obviously there's been some legislative changes in smoking in the last few years. And I'm just curious if there's any data showing that raising the legal smoking age to 21 caused a decrease in tobacco use among teenagers.
So I think that was a really smart thing to do. I think that was a really good law. You know, one of the situations that we have is most kids get their cigarettes from friends. So they get them from their peers. Most kids aren't able to get through the controls of buying them. Some are, but most of them get them from friends and family, with the majority getting them from their friends. The problem you had in high school before, when the minimum age was 18, is you've got a lot of 18-year-olds in high school. So there are a lot of kids who can legally buy cigarettes there, along with a bunch of 16 and 17-year-olds. And so with that friend pathway, it was really easy to pass those cigarettes from 18-year-olds who can legally buy them down to 16 and 17-year-olds who could not legally buy them. And so moving that age up to 21 theoretically should help shut that down. There are not too many 21-year-olds still in high school, maybe some, but not too many. And so that should really be a good way to help do that, to prevent that. I've yet to see any really good studies monitoring that, evaluating its effectiveness. It makes sense. It should be effective, but the studies just haven't been done. One of the problems we're going to run into is there are a lot of factors going on with kids when that went into place. So that went into place right around the time of the pandemic. And so the pandemic is going to have an effect on kids too, because suddenly kids couldn't go out and mix with their peers. And it doesn't have to do just with changing the age from 18 to 21. And so there's a lot of different issues there. And so it's going to be tough to separate those out. It's going to take some really good studies to do that. I just haven't seen that yet to be convinced quantitatively how much of an effect, but it makes sense. That should have an effect.
Well, and on that note, in your experience, how long does it typically take to assess data like that when a new change has come in? Like what's the time frame when we think we could probably see some results on that?
I'm hoping we'll see some results pretty soon. I don't know if we will or not. I don't really know if the studies are being done out there at this time. Hopefully they are, because it's a really, really important and a really critical question to answer. So I'm hoping we'll see data in the next 6 months or so, but I don't know. The really big surveys that are being done out there are slow, and that's unfortunate, but they really are slow. And so those big surveys are going to take a while to actually get that data, but hopefully there's some people going out there doing some smaller surveys, some smaller evaluations, and can get that data in the next 6 months or so.
So sticking with youth smoking or youth use of tobacco, can you discuss the impact of nicotine use on youth?
So nicotine is not the primary thing in cigarettes that causes death and disease, but it is the primary thing in cigarettes that causes people to continue to smoke. Now, cigarettes are not, nicotine is not innocuous. There are likely to be some particular health effects that are exacerbated because of nicotine's effect, particularly on the cardiovascular system. But when you look at youth in particular, there are two things that have been discussed as of concern. One is around brain development. And most of the studies around brain development have actually been done in animals. You know, from a scientific standpoint, you can't take a bunch of kids and give them nicotine and others no nicotine and then see how they turn out. You know, that's just an unethical study. So you can't do that. So you have to look at what's happened in the real world. And those studies just have not been done on humans. But the studies on animals do suggest that the brain is developing, nicotine can have that impact. The other side of this really is around as the brain develops, and if it's exposed to nicotine, you're going to get the creation of more nicotine receptors in the brain as it is in this developmental stage. And so it may very well be that kids who are exposed to nicotine at an early age, as their brain is being developed, become more addictable. They become more likely to be addicted because of the creation as the brain is developing of a lot more nicotine receptors. So that's areas of concern. Again, there's the cardiovascular disease, which is wide. There is this brain development concern, and then really just making those kids more able to be addicted to nicotine as they're growing up.
So I'm just curious, have you or the Tobacco Control Group done any research into the combination of cannabis use and vaping?
So cannabis is a really interesting area. It's a very interesting new area that we've been discussing as a group, what part we might be able to play in that. You know, as cannabis becomes more and more recreationally legalized across the country, not surprisingly, use of cannabis is growing dramatically. And as we've looked at it, we really are seeing that where this is headed is toward some big issues. Cannabis may very well not have all of the health effects related to tobacco, but there are concerns about cannabis use and its impact on the population. And so as it spreads, we're going to have to deal with some of those issues. And a lot of the issues are the same as what we've seen with tobacco. So one of the things we've been discussing as a group, we're still in the discussion process, is are there things we can learn from tobacco, both good and bad, and apply those to cannabis and try to get ahead of the curve? Is there ways for us to get ahead of the cannabis curve, not to allow that to be such a huge issue and then try to catch up with it, but actually get out in front of it and do the research that's needed and then do the policy recommendations so that cannabis doesn't become such a huge problem like tobacco is, and then have us catch up. So we're talking about that a lot amongst the group, the folks that I named earlier, and exactly what part we could play in that issue.
So thinking a little bit big picture, what are the biggest threats to tobacco cessation efforts?
So tobacco cessation has been hard for a long time. Very small percentage of the people who try to quit actually are successful. Only in single digit success over a long time of people quit. And that's because nicotine is so addictive. People are hoping that these new products will be effective. In my own opinion, trying to put the policies in place to make them as effective as possible is actually going to be a really important thing, because the introduction of new products that just encourage people to continue to smoke is not going to help tobacco cessation efforts. But if there are ways that we can market these products and get them to people and provide the support they need so that those new products can actually be effective in helping people to smoke, I think that's the way to go. I personally really appreciate, and this is a long time ago, what the folks, the commissioner of FDA said back in the summer of 2017, not long after I left. And they had a two-pronged approach to try to deal with the issue. And the first was to reduce the levels of nicotine in cigarettes so that cigarettes would no longer be addictive. Not just reduce delivery, but actually reduce the amount of nicotine, and then try to get the most effective alternative products on the market to help people to quit. I think that two-pronged approach could really have a big effect. The problem is we deal with a situation that's complex, trying to get things through, and in a regulatory standpoint or even policy is very hard. And so my biggest concern is that things will stand in the way of actually doing what we know to do already, and prevent us from being able to do those things.
Well, I do have a question from the audience here, and it says the Biden administration announced today a greater level of acceptance for drug harm reduction, including syringe exchange programs and providing less harmful drugs for opioid addiction. Where do you see things going in terms of tobacco harm reduction? So
tobacco harm reduction is a really interesting question. And I actually just gave a presentation a couple of weeks ago on tobacco harm reduction. Tobacco harm reduction, unfortunately, a lot of people, not everybody, but a lot of people see tobacco harm reduction in a very narrow view. They see tobacco harm reduction only referring to the individual. And so they say, if I can give someone a product that's less harmful, that's a good thing. And honestly, it is. There's no question that's a good thing. But there are a lot of other aspects to tobacco harm reduction to take into account. And that includes attraction of kids to a product that's being marketed as less toxic. It includes relapse of current smokers. One of the things I ran into when I first got to FDA, which was a bit of a shock, I went around and talked to the other directors of the offices of science at the other parts of FDA. I sat down with one of them and she said, I'm a former smoker and I'm so glad you guys are regulating tobacco, because as soon as you tell me there's a less harmful cigarette, I'm going to start smoking again. And that was a wake-up call to me. Smokers really want to smoke. They really enjoy it. And one of the dangers in tobacco harm reduction is it gives them to some degree permission to start smoking again. So we need to figure out how to encourage people to reduce their use of cigarettes and to switch to less harmful products without encouraging others to start the process. And it's a complicated issue. It's not a really simple issue. Where it's going, I don't know. Again, I really like what the commissioner said back in 2017, which is really a two-sided piece, which is not just introducing more lower harm products onto the market, but actually taking the products that are very harmful and making those much less appealing, less addictive, to try to convince people, kind of a push-pull thing, not just one side of the equation.
Well, I think the answer to that question, I think, flows well into my final question for you is, what does the future of tobacco use and tobacco companies look like in the US?
So the tobacco companies themselves for a long time have been seeing their demise, companies in particular. When I first started at FDA, which was about 12 years ago, and even before that, it was clear that the tobacco industry realized that the sale of cigarettes was on the downward slope. They were going to not be able to make as much money as they wanted to make by selling cigarettes. And so they began looking for alternatives. First, they were looking at smokeless tobacco. And so the cigarette companies went out and bought a lot of smokeless companies. Now cigarette companies have gone out and bought a lot of e-cigarette companies. Now they've gone out and they've either bought or created their own heated tobacco product company. So they're trying to find alternatives because they see the end of the cigarette in their long-term view. Not that they want it, but they definitely do see it. And so they want to switch, they want to change over. So they're still making lots of money, but they're not killing all their customers. So I think that's where the companies are going to try to go. What I would encourage, or what I would suggest, is that FDA and regulatory agencies help them get there, encourage them to get there by putting regulations in place that will help speed up the demise of the cigarette, but allow these new products that are properly designed and are properly marketed to get to the people who need them. So I'm looking for that end of the tobacco companies, the cigarette manufacturing companies. The companies as a whole that are tobacco companies will be around for a long time because these are smart people and they've got the impetus to stay in business. But I'm hoping it'll move over, and that policy and regulatory actions will help encourage that to happen.
Well, I do appreciate you answering all of my questions and the audience questions, and this has been a fascinating conversation. So I do appreciate your time, and I want to thank all of you for attending the Currents of Public Health webinar today. And again, thank you to Dr. Ashley for participating in this informative conversation. This is the final webinar of the fall series, so be on the lookout for information about the upcoming spring series. And in closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master of Public Health degree in 6 concentrations, a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health degree. The faculty and students conduct research on the complex public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, their residents, and community-based organizations committed to health equity. If you would like more information about our programs or how to support the work of the school or our students, please visit publichealth.gsu.edu and also check out our new alumni page at publichealth.gsu.edu/alumni. Thank you again to Dr. David Ashley, and thank you for attending. Please join us for our next webinar in the spring. Have a good day.